Hi everyone, today we are here to talk about non-suicidal self-injury. I am Emily and these are my colleagues Maddie and Dusty.
Hello.
We first wanted to just come in and talk to you and thank you for being here. We realize how difficult of a topic this is and that you guys are incredibly brave for being here and coming to share your stories and to learn about this really kind of tough subject. So we just wanted to thank you for being here. So we're going to get started. So, non-suicidal self-injury. So the topics we will cover today are, we're going to define NSSI, we're going to talk about some stats, we also are going to talk about the difference between non-suicidal self-injury and suicidal self-injury because I think there is some confusion there. Maddie will then move on to talking about who engages in NSSI and why. And then Dusty will come in and talk about what you can do to help. And we have come up with a friendly acronym ACE, which stands for Ask, Connect, and then Engage. So we'll go through those steps in this presentation and you will leave with some knowledge about how to approach your son or daughter. So please note that we can't guarantee confidentiality in this group, but it's really important that you kind of keep that in mind and realizing that if someone shares something personal in this presentation that you do keep that confidential. The other thing is that if you disclose abuse or imminent risk to yourself or harming others, or your child does, that we will have to report that. We wanted to make a note about language. So language is really important when we're addressing our kids, and it can be really off-putting when you say like cutter or burner. So we're going to say a person who self-harms, a person who cuts. We want to use the person first language when we do this instead of just saying that like they're a cutter. So we're going to start with a little bit of an activity. I have passed out paper and pencils for all of you guys, and you're just going to write down any thoughts, feelings, memories, that you have about self-harming, and just kind of what comes up for you. We're not going to be sharing these, but we're just going to come back to this later. So we're going to take about 30 seconds to just write down whatever is coming up for you right now. Remember, you're not going to be sharing this, so please feel free to write whatever you would like. Okay, so we'll come back to that in a second, but just pass it off to the side and we'll move on. Okay, so moving on to defining non-suicidal self-injury. So NSSI is the direct, repetitive, intentional injury to one's own body tissue without suicidal intent, and it's also not socially acceptable behaviors either. So when we talk about NSSI, we're talking about cutting, burning, hitting oneself, carving. We're not talking about tattoos, piercings, nail biting, other socially acceptable forms of damaging your own tissue. So remember cutting, burning, hitting, carving, those kind of categories in this presentation. So the prevalence of NSSI. So it typically occurs in adolescents between ages 11 and 15. It also has higher rates in females. 7 to 25% of adolescents and young adults engage in NSSI at least once in their life, but that 75 to 80% of all reported NSSI is repeated. So pretty high prevalence of repeated NSSI, which is something to just be aware of. It's also important to note that females have higher rates of cutting and males have higher rates of hitting themselves. So just kind of keep that in mind with your own child of behaviors that you might be thinking about or being concerned about. So NSSI and suicide. So in this presentation, we are not talking about suicide. We are talking about non-suicidal self-injury, just as the name explains. But it is important to remember that NSSI is a risk factor for suicide because NSSI habituates us to pain and violence, and it also lets the person know that they have the desire and capability for suicide, but you have to remember that NSSI is not a suicide attempt. So they vary in 3 different ways with the intention, repetition, and lethality. So the intention of suicide, most people or non-suicidal self-injury, most people don't have any intention of dying when they're self-harming. So that's important to remember. The next is repetition. So repeated self-harming becomes less effective over time, and that becomes a higher risk factor for suicide attempts. So, and also, most people who engage in NSI do it repeatedly, so there is the difference. Also with lethality, the methods for engaging in NSSI are usually less severe than behaviors with the intent of suicide, and the damage is usually not life-threatening, although it is important to notice that there are certain things that do require immediate medical attention, which we'll talk about later. So my colleague Maddie is going to step in and talk about assessing the risk level of your child.
Okay, thank you, Emily. So before I get into talking about who engages in non-suicidal self-injury and how that's effective or why that might be happening, I want to briefly touch on this since Emily introduced the topic of suicide and self-harm, and what do you do? How do you know that it's not a method of suicide? And so a couple things with risk level. So first and foremost, we want you to understand that when we're talking about self-harm, we're also not talking about imminent self-harm, as in imminent and dangerous self-harm. So if your child has already harmed themselves, if they're in imminent danger, the harm has happened, and the bleeding, for example, has not stopped if the person has engaged in self-harm through cutting. After 5 to 10 minutes of applying pressure, so basic first aid, call 911. Okay, so we're going to talk a lot about what you can do in terms of self-harm. That is, there's no imminent danger at that moment. But if there is some imminent danger happening, you can and should call 911. Also, if the self-harm is a suicide attempt. So then the question is, how do you know if it's a suicide attempt? And the way that you would know is to ask directly about suicide. So the way that you ask is just to say what you've noticed and then ask directly. So I've put an example here. Hey, your child's name, the child who you're talking to, whatever their name is. I've noticed whatever the reason is that you're bringing this up. Are you thinking about suicide? And you say it that plainly and directly. If you want to take just 20 seconds to practice saying that out loud, maybe just turn to your neighbor. I just want you to practice saying, hey, I've noticed you're pretty distressed lately. Are you thinking about suicide?
Hey, I noticed you're pretty distressed lately. Are you thinking about suicide?
No, I'm not right now.
Okay, thanks for telling me.
Great. Good job, you guys. And so we're stopping just to practice that really quick because I understand that that is something that you're probably thinking about and concerned about, and the best way to find out if the self-harm is related to suicide is to ask directly about suicide. And then if you get a yes, I would suggest calling the National Suicide Prevention Lifeline and working with them on what to do next. If you get a no, then you can continue with what we will talk about today, the suggestions that we will have for you. Okay, so moving on to talking about risk factors for non-suicidal self-injury. So risk factors are the things that basically flag us to who do we need to be focused on providing support to potentially. But they're just meant to be flagged, so they're not absolutes. These are not, if you know a child who has these risk factors that I'm going to talk about, it doesn't mean they absolutely will engage in self-harm. And there can be people engaging in self-harm who fit into none of the boxes that I'm going to talk about. So I'm going to talk about the risk factors, but with that caveat to remember that anybody can be engaging in self-harm, and these are not absolutes. Okay, so first risk factor, I put gender with a question mark because there is a slightly higher risk of females engaging in self-harm. Emily talked about that a little bit before, but it's only slightly higher. The other difference with gender is that females tend to start self-harming earlier and they self-harm for longer. Males And then males report self-harming with a social factor. So they self-harm with others present, or they self-harm using other people. So maybe like their friends are hitting them purposefully. It's like a game. And males also report engaging in self-harm when under the influence of drugs and alcohol more frequently. Okay. Sexual orientation, I also put a question mark there because we're not positive why it's linked. We could have a lot of ideas about why it's linked, but it is shown to be a significant predictor of self-harm. So if you have a child who identifies as bisexual or who identifies as being attracted to the same sex, that significantly increases their risk for engaging in self-harm, and pretty consistently across the research. Lack of social support. Lack of social support. So that's a pretty obvious one. If they don't have social support, they're feeling pretty alone. That's a higher risk for engaging in self-harm. We'll talk about that a little bit more on the next slides. Low self-esteem. We'll talk about that. We'll come back to that on the next slides, but just know that for now that's a risk factor. There we go. Negative emotionality, so just meaning less positive emotions in their daily life. So if you have a child who's consistently experiencing negative emotions, like daily they're having negative emotions, that's something that you can notice for a risk factor. Same with negative cognitive style. So that means thinking in a way that's really consistently negative, maybe always blaming other people or always having a filter on of like everybody hates me. It kind of matches with that low self-esteem. Okay. So history of thoughts of suicide or suicide attempts. So that link comes up again where it's not always, self-harm doesn't always mean suicide, but if they do have a history of attempting suicide or of thinking about suicide, that's definitely a risk factor for engaging in self-harm because we know that they have a high level of distress. And then previous self-harm, that's a pretty obvious one. That comes back to Emily's statistic that she shared that 75 to 80% of self-harm is repeated self-harm. So if they've done it once, it's pretty likely they're going to do it again. So then I have this other category of risk factors over here. So these are disorders that we commonly see in combination with self-harm. So kids with these disorders are also often self-harming. And I put the names of the disorders, but also understanding that the symptoms of these disorders are pretty good risk factors. So maybe your child hasn't been diagnosed with a depressive disorder, but you're noticing that they're consistently depressed, or they haven't been diagnosed with an anxiety disorder, but you can tell they have a significant amount of anxiety. Those are some risk factors that you're going to want to notice and have a little flag in your head for thinking about whether they might be engaging in self-harm. Post-traumatic stress disorder is one that has a really high, in the research it's shown to be really highly correlated with self-harm, and specifically the trauma being physical abuse and sexual abuse. So if you know a child who has been abused physically or sexually, those are really consistently correlated with self-harm, and that's something to keep in mind. And then the last note that I have on this is this note about exposure, because I think that this is something that gets brought up a lot, that they're learning about it through the media or through their friends, and research has shown that to be true, actually. So maybe the kid with some of these risk factors, they don't have much social support, they're female, they have pretty negative emotionality, sees in the media, maybe on social media, that somebody else is engaging in self-harm, and that sort of links it in their head. And then they, think, okay, maybe that would work for me. It's not sort of so like linear and simple as that, but there is that sort of link that exists, and research has shown that to be true. And the only reason I want to bring that up is to validate that is extremely frustrating, right? To think like, if only they didn't see this, if only kids weren't sharing this, if only we weren't talking about it. And it can also make you not want to talk about it because you think, okay, what if I expose them to it and then they try it? But really, and Dusty will talk about this more, it is so important that you ask, and regardless of how they came to that behavior, it's important that we intervene. So we can acknowledge that frustration, but then know we have to intervene regardless. Okay. So to put it simply, when we look at all of these risk factors, high emotional dysregulation, so all of those risk factors have some level of that individual is really emotionally dysregulated, meaning that they are not able to regulate their emotions and they don't have effective coping skills. And I bolded effective there because that's really the key word, because we sometimes can look at all the coping skills and say, well, they have all of these coping skills, but to them, if it is not effective at regulating their emotion, then it's not going to work. So what this comes out to is non-suicidal self-injury is really about emotional regulation. There's a lot of theories out there in the research, but this is the one that is consistently found to be true, basically. So what is emotional regulation? It's the attempts that we make. So all of us regulate our emotions all the time. It's the attempts that we make to influence which emotions we have, when we have them, how we experience and express them. So I'll say that again. Emotional regulation is the attempts we make to influence which emotions we have, how we have them, and how we experience and express them. Okay, so let's talk about that emotional regulation piece. How is it effective at regulating emotions? Because I can understand that you might look at self-harming and say, I don't understand how this is effective. It's painful. I don't get what's working about it. So let's talk about that. What is the function that it has? So we've got two categories of functions. Intrapersonal, meaning internal, ways that it's functioning internally, and then interpersonal, meaning social. What is the function socially of self-harm? So let's first talk about these intrapersonal. What is it doing internally when somebody is self-harming? First, we have automatic negative reinforcement. Negative meaning taking something away. So not negative as in bad, negative as meaning taking it away. So I just want these bad feelings to stop. This is the most common reason that individuals say they engage in self-harm. So bad feelings meaning they want to relieve feeling numb. So they want the numb feeling to stop. Or they want to stop the anger, anxiety, frustration, sadness, depression, whatever the feeling is that feels like too much, they need it to stop, and so they engage in self-harm to get that feeling to stop. So again, they're regulating their emotional experience. They also might be stopping bad thoughts, so it's not always just bad feelings. Sometimes it's bad thoughts, including thoughts of suicide. So I don't want to think about this. I don't want to have these thoughts. I need to do something to stop them. Self-harm can sometimes be effective at stopping them, and that can be the reason they're engaging. Or to stop dissociation, which is when you feel, the short of it is when you feel outside of your body, when you feel like you're not experiencing things, and if that can be a very scary experience. So self-harming can stop them from feeling disconnected from their body. It reconnects them. So it stops that dissociation. And that's really common with individuals who have suffered trauma, as I discussed before, physical or sexual trauma. So that's the first reason, negative reinforcement, taking away the bad feelings, stopping the bad feelings. Then we have automatic positive reinforcement. So that's adding something. That's what we mean by positive. Not good, but adding. So to feel something, even if it's pain. So this is the next most common. These are the two most common reasons that people report engaging in self-harm. So this can be adding self-punishment. So that can be what they're trying to add. They're trying to feel like they're being punished. And we'll talk about that again on the next slide, actually, or in a couple of slides. Especially, again, during dissociation. And I forgot to say this at the start, but these are usually all sort of linked. So there's some that are most common, but they all connect. So if we think about dissociation, they want the dissociation to stop, and they're going to do that by feeling something, even if it's pain. So it comes together for both those reasons. This one, the positive reinforcement, is particularly problematic because what this does, they're not feeling anything and they're trying to feel pain. So it increases their habituation to a pain response. We're going to come back to this in a couple of slides. It increases their fearlessness of that pain response, and they have to keep upping that pain response. So it can lead to that accidental or even purposeful suicide attempt. So here again is that link to suicide, not automatically a suicide attempt, but there's definitely a link, and especially if they're engaging in self-harm for this reason, to add the pain. Then we have interpersonal, which is the social reasons that individuals are engaging in suicide. Or, sorry, not suicide. The social reasons that individuals are engaging in self-harm. I got myself mixed up. So this first one, negative reinforcement, again, negative meaning taking something away. I wish people would leave me alone. So this could particularly be if somebody's being bullied, they might engage in self-harm to try to get the bully to stay away. It also can be to avoid responsibilities that are causing significant distress for them. If they're really anxious about some sort of responsibility and they want to avoid doing that, this might be the way that they are able to avoid that. And then this other one, social positive reinforcement, meaning adding something by positive. I'm going to keep reiterating that. This is, I wish people would pay attention to me. So they're seeking help and attention. Maybe they're trying to fit in with their peers. This is the one that we most commonly think about, especially when we're frustrated, like, oh, it's just searching for attention. And that can be true. It can be a way of asking for help. But the point is that they're asking, and we need to respond to that asking, and remembering that this is all tied together, right? So a kid who's not experiencing distress probably won't self-harm just because they want attention. That would be pretty rare. Probably they want bad feelings to stop, and they're asking for help. So in that way, it's all related again. Okay. So let's talk about why they keep doing it, because you would think it would hurt and maybe they would stop after the first time or stop after they get attention, and that can be really frustrating to say, okay, you've got what I think you wanted, so why are you still doing it? So this cycle of self-injury helps us understand that. If we remember Emily's statistic of 75 to 80% of all self-harm is repeated. This cycle helps us understand why that is. It's a self-reinforcing cycle that's really hard to get out of. So basically, they're experiencing high levels of activation of negative thoughts or emotions. So we're over here. That tension is building. They don't know how to regulate their emotions. They're feeling extremely dysregulated. They're having this urge, like, I have to do something about these emotions. What can I do? They've experienced self-harm as working before, and in a minute I'll talk about another reason why it works. So then they act on that self-harm, and they experience relief, right? Those emotions probably do go down. They do have some regulation of those intense, distressing emotions or negative thoughts. It works. What they don't experience relief from is guilt and shame. So even if the other feelings go down, these feelings of guilt and shame either come up new, maybe they weren't there before, or they continue because they feel really guilty and ashamed of themselves for engaging in this behavior. That's pretty consistently the case. So then this guilt and shame triggers these negative thoughts about themselves. Often that self-punishment piece comes in. So we talked about that on the slide before, that some kids will engage in self-harm to punish themselves. Even if they didn't start engaging in self-harm as an act of self-punishment, now they might start engaging in it as an act of self-punishment because of this cycle. So those negative thoughts happen again because of this guilt and shame that's left over, tension builds, and we start the cycle over again. And it basically keeps repeating because this guilt and shame is so heavy and distressing, and it does a really good job of keeping this cycle going, despite them having help or it hurting or whatever is happening that seems like it should keep them from engaging in it. Okay. So the other thing that we need to talk about is this idea of addiction. And you might have heard this before, or you might not have, but if you start looking into self-harm, you'll see this popping up a lot. There's no 100% factual link between basically an addictive process like in the brain and self-harm. We can't say for sure if it's the same thing as an addiction, but there are ways that are really similar, and this might help you understand that process of engaging in self-harm repeatedly. So these are the things we already talked about. Self-harm is acting as a form of self-medication in that they are regulating their emotions. It's like a medicine for the emotions that they're experiencing that they feel really dysregulated from. The shame and guilt reinforces the maladaptive coping strategy of self-harm. That's the same for somebody who's addicted to a substance, for example. They continue to use the substance partly due to the shame and guilt they feel about using it. It's seems really contradictory, but it's just the way that cycle works. And I actually put an image of the addiction cycle here so you can see guilt is there, which is the trigger that starts the craving again. So sort of what we just talked about with the cycle of self-harm. And then difficulty controlling the urge to self-injure. So we talked about that also on the last slide, where those emotions build or those negative thoughts build, and they feel like they have to do something, and self-harm is the coping skill that they know will be effective at relieving those negative emotions. So and for some people this is even in the absence of an identifiable trigger. So those emotions just build. Again, we talked about on risk factors, like individuals who are consistently have negative emotionality. So those individuals, it's hard to see what the trigger is, but they're feeling constantly negative emotionally. So this is the other piece of the addiction sort of debate or theory. So the pain, after somebody self-harms, the pain that they're experiencing or as they self-harm activates these pain perception system, which releases mood-boosting endorphins. So that's part of what makes it effective at relieving the distress, right? There's this immediate sort of high of the endorphins. So every time that happens, that pathway, the pain perception system is activated, there's an increased tolerance. It's just a little bit less effective the more that you do it. So with that increased tolerance, they have to have deeper injuries to feel the same effect. So when we're thinking about cutting, that can especially be problematic in that sense. And then as the tolerance increases, as do the withdrawal symptoms. So that part of the cycle where they're feeling the urge to act, that's part of the withdrawal symptoms of I need this. So even if they're psychological, maybe they're not physical, but they feel very physical because something in their brain is saying, I need to do this. And then they repeat the behavior, which we can also call a relapse in addiction terminology. This furthers what we were talking about before with the habituation to pain response. If they're having to have deeper injuries to feel the same effect, we're now increasing that risk of serious injury or even death. So that was a lot of information and can be very scary. So now we have to talk about, well, what can you do? Protective factors. So I started this section with talking about risk factors. Protective factors are the opposite of risk factors. They help us deal more effectively with stressful events, and they decrease the likelihood or the impact of risky health behaviors like non-suicidal self-injury. These all come from the U.S. Department of Health and Human Services. We can't control all of these, right? We can't go to school with our child and make sure they're engaging in learning. There's just some things that we can't change. We can't make sure they always have positive norms around them. But we can control the things over here, and especially this one, supportive relationships with family members. We can offer that supportive relationship even if they act like they don't want it. And that is what Dusty is going to talk to you about next.
Hi. So, thank you, Maddie. Nice job. First, I want to reiterate what Emily said, and Maddie as well, that we want to thank you for being here today. It takes a village to raise kids in our community, and whether you're here as a parent, a teacher, a community member, a friend, maybe you know someone who's engaging, maybe your child is engaging in non-suicidal self-injuries, we want to thank you for being here, because what you're doing is you're taking that first step towards learning, and you're showing that you care. And Maddie said very, very eloquently that kids don't often act like maybe their parents are the most important people to them in the world. And I'm a parent, I have felt that many times. And research consistently shows that your relationship is one of the most important relationships in their life. So how you respond matters. Your relationship matters. And before we go any farther, I want you to ask yourself just a few questions. And I'd like you to pull that piece of paper out that you started with. Emily asked you if you wouldn't mind writing down some feelings, some emotions, maybe a memory or a thought that came to you when we started the presentation. And depending on why you're here, I want you to look around the room and recognize that what you wrote on that paper, likely there's at least one other person in this room that feels very similarly to you, and probably several of the people in this room have some sense of fear, anxiety, shock, worry, confusion, anger, guilt, or shame. And so you're not alone in this situation. And coping with a child who self-harms is stressful. And it's really important that we remember that we are, A, our relationship matters, and B, we are our child's first and best role model. And so dealing with that emotion and those feelings that are on that paper is really important. You've heard it a million times before, that if I don't take care of my own issues and my own feelings, and if I don't take care of myself, then I cannot take care of my child. And so whatever you wrote down on that paper today, we're not going to ask you to share it with anyone today. Many of us are probably strangers in this room, but I'd like you to put that in your pocket as a reminder to take care of yourself. So we all say, oh yes, I need to take care of myself. Self-care is really important. What does that really mean? Well, in this kind of situation, you might need to talk to a trusted friend, a pastor, a doctor, or a counselor. You need someone that you can talk to who is knowledgeable and who will keep your confidentiality and to help you deal with some of these emotions that you might be feeling. In addition to this emotion that you might be feeling, maybe there's other things happening in your life with job or marriage or social situations that, again, add to your stress. And you are your child's most important role model. If we are not dealing with our own issues in a healthy way, then they cannot learn appropriately how to deal with those things. And I know that's really hard to think about and really hard to admit, but I am right here standing up in front of you telling you that I have to constantly remind myself to do this. And we are not sitting up here trying to tell you that this is your fault by any means. At the same time, we play a role, and a very important role in our child's life. So to me, this is the most important piece, is building that relationship, showing them that you care, and how you respond. That feeling of shock and anger and worry is normal, it makes sense, and we need to learn not to project those feelings and add those feelings into our child's life. Emily mentioned that this is most common with adolescents age 11 to 15, and we need to make sure that we remember that as a teenager, developmentally, their brains are still developing. Their emotions are high and low and all over the place. Their hormones are up and down, and there's a million and one things happening in their lives. And so we need to make sure that we're not adding any more pressure or stress or anxiety or bringing our worries onto them. And so how do we respond to our child when this happens? Of course, your responses make sense, and it's important for you to take that time to take care of yourself. So don't project your feelings. And how do you take care of yourself? Some of the same triggers that maybe Maddie mentioned, those risk factors. Is your child isolating themselves? Are you isolating yourself? Do I spend a ton of time on the computer and on the internet? I need to take a look at my own behaviors. Do I exercise? Do I eat well? Am I sleeping well? Am I engaging in the activities, my hobbies, creative outlets that help me to become a balanced person? And that's really hard sometimes to take a look at ourselves and what we're doing. But again, we remember if we're not taking care of ourselves, we cannot take care of our children. So moving on from that, I just want to encourage you to keep that piece of paper and remind yourself to take care of those feelings, take care of yourself so that you can take care of your child. The next thing is, how do I know if this is happening with my child? Again, your intuition is really important. However, there's a lot of things that that might be happening right in front of us that we want to deny isn't happening. And some things that I was a little bit surprised about when I did a little bit more research on this subject. If your child is wearing a lot of wristbands, like constant wristbands, constant bracelets, they might be trying to cover something up. There's a lot of secrecy in this behavior, and so they're often trying to cover it up. And that goes along with inappropriate dress for the season. I kind of laughed when I saw that, because what teenager doesn't dress inappropriately for the season? However, this is excessively dressing inappropriately for the season, and they're often trying to cover up. So big, large sweatshirts, always covering up certain body parts, and then maybe avoiding certain activities because maybe they are going to wear a swimsuit, or maybe they don't want to go to prom because most of the dresses are sleeveless, that kind of thing. So it's really important. The other thing I kind of laughed about was concerning friend groups. It's really hard to stay in touch with who your child's friends are. And it's also important to recognize that some friends they may be hanging out with because their friends can actually relate to what they're going through. And also, it also might be that there is a negative, there is some negative things happening in their friend groups. And so again, we have to be very mindful and careful and thoughtful when we're thinking about these kinds of red flags. Maddie mentioned the contagion, the possible contagion effect of this behavior. And again, that's why friend groups are really important, because not only do we need to be aware of the contagion effect that could happen or is happening, but we also want to be aware of what that friend group is potentially, how that friend group is helping our child. So it could be a little bit of both. So what else? So if you think you see something, you can't ignore it. We must ask a few questions. We have to ask a few questions. We have to respond. And how we respond is really important. We talked about those fears, those anxieties, the anger, the shock, the worry. That's normal. And we have to try to, when we respond, to be respectful, curious, and figure out how to collaborate with our child once we identify that there's a problem. It's really important not to minimize this or ignore it. because once it happens, as Maddie talked about, that cycle could continue and oftentimes does continue, and it gets harder and harder to stop if we don't intervene. So as soon as you think there's a problem or know there's a problem, start asking them some questions, start trying to connect with your child. It's really important that you clearly state to your child, I am not judging you. I am here for you and I'm committed to helping you because I care about you. So again, clearly state those things. Respond with a calm, compassionate demeanor. Calm, curious, compassionate, 3 C's. Yes, Maddie also mentioned assess the situation. If you've walked in on your child in the bathroom and they are engaging in self-harm, you need to do a quick assessment. Are they in immediate danger? And if they are, deal with it right away, as Maddie discussed. You might need to call 911. Most often, that is not the case because they are not trying to commit suicide. They have injured themselves in a way that can be dealt with very calmly, very pragmatically, very carefully, and of course also assess that contagion risk. But again, assess and then deal. Ask some questions, intervene with a caring manner. If, as I mentioned, you walked into your child and they are self-harming, stay calm, take care of the wound, and then when everything has calmed down, then work on that connection piece. I have listed a few useful and direct questions. It's really important that you do not ask directly, why do you do this? Because the reality is many of them don't understand it themselves, and that will only cause them more stress and anxiety. Now, we do need to try to get to the why, but asking them directly why is not an effective question. So we need to get around that why question by asking them and being curious about what it does for them. Do you notice any patterns? And you notice my tone of voice. I'm trying to be curious, I'm trying to engage with them, and I'm trying to ask them how I can help them. Ask them if you can teach them some first aid, because harm reduction, caring for their wounds, infection, those kinds of things are something we really need to be careful of. And if we can teach them how to care for their wounds, that might just help us kind of bridge that gap between connection and getting them to talk with us a little bit. So those are just some questions. Feel free to write those down if you'd like. And again, if you want to talk to us afterwards, that's just fine too. The biggest thing and the most important thing is once you are in that position to be asking some questions, we need to listen to our child. Now, we all think that we listen, and again, I am guilty here as well, but we need to ask ourselves, do I really listen, or do I lecture my child? If your child will not talk to you, it's important that we take a few moments and just ask ourselves why. And that's really hard. Some ways around that. Offer them a journal. We actually brought some journals for you today to take. Journal doesn't have to be anything fancy. It can just be a notebook. So we brought some notebooks. Offer your child a journal or a notebook. Write them a note that tells them that you love them, that you notice a few things, that you're concerned about, and you're hoping that they might just talk to you about what might be going on for them. And then be patient. Give them a few days with that journal. Drop them a text. Teen language today is texting. It's Snapchatting. So drop them a text. Be patient. Control your anger. Control your worries. Try to talk with someone else about those emotions that are real and make sense. But with your child, you need to just try to ask them a few questions and get them talking with you. We also have a workbook here and a book for you tonight if you're interested in these things. This workbook is another way to get your child talking. Just hand them the workbook. Just say, hey, I noticed that some things are happening. and I'm a little bit concerned, and I wondered if you might consider taking a look at this workbook with me, or just give them the notebook and see if they might bring you a page. There's a really, really awesome page in there that encourages them to write a letter to their parents. So it offers you some really useful tools. So if you're interested in that notebook. Another idea is impulse control logs. And again, we can go into more detail on these kinds of things, but they're just some really simple tools that you can use. As well, if they won't talk to you, would they be willing to talk with someone else? And again, I know this is hard for parents if our kids won't talk to us, but just getting them talking is important. If they will talk to a trusted friend, family member, or counselor, awesome, because we need them to start figuring out what to do with all that emotion that is triggering these behaviors and is causing these behaviors. So this is a good time, if you ask them if they'd be willing to talk with them, try to explain to them what confidentiality means. Counselors, doctors, pastors, those people are, by their profession, codes of ethics, they must keep people's confidentiality. So it's a safe place for kids to talk to them and not worry that they're going to be talking to the whole school or talking to the whole community. So, thank you. Couple of questions that I put. If they will talk to you, you need to ask them some specific questions. What do they need exactly from you? And then listen to what exactly they want from you. Ask them what they don't want you to do. There may be people that they are not comfortable with and that they do not want you to talk to. Find out the best place to talk to them is. Will they talk to you on a walk, in their room, at a restaurant, at a coffee shop? Where will be a good place for you to have a successful interaction? And let them take the lead on that kind of thing. Ask specifically if they know why they're having a particular urge to cut that particular moment, for example. And again, that could be any self-harm injury. Help them go backwards into their day to try to figure out what is triggering their behaviors. And I already talked about if they won't talk, what to do. So I'm going to play a little video here, and I'm going to admit to you, when I first saw this video, I was appalled, and it made me really uncomfortable. And at the same time, there's a couple really important things about this video. Number one is when you are dealing with somebody who is engaging in self-harm behaviors, it's very common for parents to want to focus on the burns or the cuts or the carvings. And that isn't going to help. We need to focus on the person, and we need to listen very carefully to what they're saying and not try to jump in and fix the problem and solve the problem. Just listen. So enjoy.
It's just, there's all this pressure, and sometimes it feels like it's right up on me, and I can just feel it, like literally feel it in my head, and it's relentless, and I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail...
See, you're not even listening now.
Okay, fine. I will listen. Fine.
It's just... Sometimes it's like there's this achy... I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. All of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just...
Don't...
So you can see why I personally had a little bit of trouble with that video at first, but it is wonderfully poignant in that listening is really hard to do, especially when you are looking at the person who you love and care about so much and they are harming themselves. And so I just want to, we want to play that video as an example of what it means to have empathy, and how just by saying something like, "This sounds really hard," is very important to validate their feelings. So one other thing is that research has shown that most often parents don't discover it first. It's often discovered maybe at the school or by a friend, and a parent will get a phone call. So what we'd like to do right now is we're going to have, my colleagues are going to demonstrate what it might be like and what we envision an afternoon might look like after you've received a phone call from someone telling you that your child has engaged in self-harm. Okay, good luck.
So we'll just do this really quickly since we're running a little low on time, and I'll do one example of myself being the parent and approaching Emily maybe in a way that conveys judgment, and we'll see how Emily responds, and then one really quick one where I approach Emily in a way that hopefully conveys some respect or empathy. So Emily, I got a call from your teacher today, and I'm just wondering why. They said you're doing something, cutting or something. Just wondering why you're doing that.
I'm not. Why do you think
Okay,
that?
well, that's obviously a lie, so.
Well, I'm not going to tell you anything because you're getting mad for something that doesn't even matter. So just I'm fine. I'm not. I'm fine.
Great, so we can see how that conversation is going to go. So let's do a second one. Hey, Emily, so I got a call from your teacher today. They sound pretty worried about you. Something about your arms. It sounds like maybe you've been cutting yourself or hurting yourself. And, before we talk about this, I just want you to know that I care about what's going on. It sounds like you're maybe in a lot of distress. I don't know. Maybe you could tell me what's been going on.
Yeah, I'm just really stressed out and just super anxious, and it's just really hard. So yeah, I have been, and I feel better when I do it, but I just didn't want to tell you because I didn't want you to worry.
That makes total sense. Yeah. Obviously, that's a super streamlined way. It's not going to look like that you'll just say, I noticed this. They'll be like, yes, and here's all the reasons I did it. But just trying to show a little bit of that difference between the way that I approach and the response I'm going to get. And even if I said all of the empathetic things and she then said, I don't want to talk to you about it, I can then look to her and say, well, we really do have to talk about this, even if you don't talk to me. Mm-hmm. So I wonder who you'd be comfortable talking to. Can you think of anybody?
Yeah, I think I kind of want to talk to a counselor, actually.
Okay, boom, that was easy. It might not be that easy. If she were to say, I don't know anybody to talk to, we can call the suicide hotline together, or the local crisis hotline together, which you'll see on your handout is listed. So, yeah, thank you.
Thanks, you guys. Again, it's a really hard conversation to have, and I think the important thing is to try to be curious. And when you're asking questions of your child, be curious and try to be patient. It's really hard. Yeah. So after that connection, or once we think about connection, we also need to think about engaging and how we can help them. So hopefully we've begun some conversations and we've learned a little bit more about maybe why they've self-harmed or how it's helpful to them, why it works for them. And again, ambivalence is really normal at first, and that's why that curiosity piece and that collaboration piece and that respect piece is so important when you're having these conversations. So finding out what coping skills do work for them is a way that you can transition and try to help them engage in other ways. And we actually brought some really common coping alternative methods. So when people are engaging in self-harm, one really simple, easy thing to encourage them is having a lot of rubber bands around. Encourage them to wear rubber bands on their wrists, and they can just wear the rubber band, and just that feeling when they snap the rubber band on their wrist. Again, it's a reduction. It's still self-harm, but it's a reduction, and harm reduction works for this. It works with addiction cycles. It works to get them to start thinking. If we try to tell them we're going to stop this behavior right now, likely you won't be successful. Parents always wonder, should I take away all the sharp objects in my home? And the answer is no. That will actually cause them more distress, and it's a way to control them, and that's actually potentially part of the problem. So rubber bands. We also brought a bunch of red pens for you to take. So we have a whole bunch of red pens for you to take. So if your child comes home and they're writing, and red is actually significant for a reason. So take some red pens home with you and encourage them to write on their arms. There's not a huge amount of harm. It's really not what we want to see, but at the same time, it's better than actually making a cut or a burn or engaging in some more harmful mechanisms. So we need to collaborate with our child and give them some other coping skills. We also have a handout for you to take to put on your fridge, and this is developing a safety plan that you can that goes right on your fridge. So if your child is feeling like engaging in self-harm, they have something on their fridge with their coping mechanisms that are healthy for them, that they've come up with for them to engage, because the key is to delay the action of self-harm. And so if we can delay it by 5, 10, 15 minutes, if they can call a friend, if they can go for a walk instead, oftentimes just getting over that hump for the 15 minutes will help them move past it. So again, having something like this on the fridge, and we've made copies for you today so you can take these home, but you should develop this with your child. The safety people that they trust, that they can call and talk to, their phone numbers are right on here. So they don't have to think, what do I do? It's right here on the fridge, okay? Again, developing that support system, we've talked about that repeatedly. This is really important because you alone cannot handle this with your child. They alone cannot handle this, and the wider their support system, the better. You may be concerned about talking to other people that they might not know. Well, yes, you might have to provide them some education, and that's okay. And that's why we thank you for being here tonight to learn and to engage and be a part of it. I'm trying to think if there's anything else. Oh, what if they don't want to go to counseling? Very quickly, it's important. If they are engaging in self-harm behaviors, you do need extra help. And so, very simply, you are the parent. You can say, since we don't agree on this, let's call in a third person to get their opinion. And, maybe mom doesn't know what I'm talking about here. I hear what you're saying. You feel differently. We disagree. Let's get a third person to come in and help us, a professional who's aware and knowledgeable about the subject. So again, just remember you are the parent, and it's okay to get help, and it's important to get help because you are not alone. I think Emily is going to...
Oh, really quick before Emily...
Oh yeah, sorry.
Yeah, and Dusty had a great opening to this, talking about getting a counselor involved. Really quickly, just want to touch on this duty to warn and protect. So counselors have an ethical and legal obligation to prevent clients from harming themselves or others when there's clear and imminent danger, meaning there's foreseeable harm, it's concrete, it's a believable threat, and there's an identifiable victim. And in self-harm, the victim would be themselves. So they have this ethical and legal obligation to warn somebody about that and to protect that client, but it's not always clear what falls under that duty to warn. So with self-harm, it's hard to know when it becomes imminent. It can be really difficult to know how and when to engage in this duty to warn and protect. So when you see a counselor, have a conversation about this. With your child present, have a conversation about what duty to warn and protect means in the context of your child's self-harming behavior. So now Emily will just wrap it up.
Yeah, so we wanted to thank you for coming to our presentation. I know this is a really hard topic to talk about, and your guys' bravery with being here is really great. Know that you are not alone. It feels like you're alone. It feels like your child may be the only one that ever does this, but you're not. And the more you reach out, the more you will find that this is a pretty common thing, and there are people out there that will support you in this. Ask kids questions and listen. The most important thing is just to listen to them. Don't have any judgment. Don't get angry. Just listen. Spend one-on-one time with them. Relationships are one of the number one important thing in a child's life, and the support that you can provide to them can make the difference of these outcomes. And educate yourself on this. You being here, reading books, talking to other people, educate yourself about these really hard topics. Model healthy coping skills and healthy behaviors to your kid. Get the proper nutrition, get enough sleep, do those things that reduce stress. Do it as a family, and then also seek professional help. The big thing with counselors is let your kids decide who they want to see. Interview a few of them. If it's not a good fit, it's not a good fit. And counselors understand that. So just find someone that's going to work with your family and with your kid, and everything is going to be okay. We'll be here for another few minutes to ask any questions. We have notebooks, we have rubber bands, we have a whole bunch of things that you can take home to help your kid in the event that they are self-harming. So we wanted to thank you for being here, and if you have any questions, feel free to talk to us.